Hi, my name's Dr. Rachel Corman. I'm a feline medicine specialist at Cat Specialist Services, and this video is to provide some information on the use of appetite stimulation medications in cats. As we know, cats need to eat daily in order to maintain their protein intake, and they don't do very well from a health perspective if they're not ingesting protein daily. So we need to make sure that our sick cats are eating as soon as possible. And appetite stimulation medications can form a very important role in the treatment protocols for individual patients. Now, remember, if your cat has been off their food for a number of days, it's very important to seek veterinary advice about this, because it's very abnormal for a cat to go without food for that length of time. There's different medications that are available that have the side effects essentially of helping to increase appetite. The main one that we tend to use is a drug called Mirtazapine. So this is a human medication, and one of the side effects that was seen with its use in people was that people became very, very hungry when they were on this medication. And that's certainly something that we recognised in cats as well. So there's a few different ways that the medication can be administered. It can be administered by breaking tablets down into small amounts. We get specific tablets made into a specific size, so these are little capsules that are available. But it's also a medication that can be put into an ointment, and then this ointment can be rubbed onto the skin of your cat's ear. It's important that you wear gloves when you're doing this, and then your cat can absorb the medication through the skin. Now, note that there's a lot of medications that this doesn't work for, this modality of drug delivery, but Mirtazapine is one that seems to be very effective in its administration in this form. For further information on transdermal medications, please visit our website, where there are some additional videos on how to administer this form. When we give Mirtazapine, typically we see the effects of appetite stimulation within about 30 minutes of your cat receiving the capsule. So if your cat's on the capsule form, give the medication and then wait 30 minutes before offering your cat food. And that should have its peak effect around about that time. The transdermal form can take slower time to reach its peak effect. It often takes potentially 24 to 48 hours before we see that increased sort of blood levels of this medication. But once they've achieved that level, it tends to stay sustained in a very nice fashion. When we're administering the capsules, we really administer it based on effect, no more than once a day. But in cats, for example, that have kidney disease, they may only need to have this medication every 2 to 3 days. The kidneys are involved in excretion of the medication, and so if your cat's kidneys are not functioning perfectly, then the drug may stay in their system for slightly longer. Hence, they don't need to have daily administration of the medication. This medication is very safe to administer to your cat at appropriate doses. If they're getting too much of the drug, then some of the side effects that we can see can be increased vocalization or excitable behavior. But this tends to occur only when doses are higher than the typically recommended doses that your vets will give. There are other medications that can be used for appetite stimulation. One other medication is a drug called gabapentin. Now, it doesn't have the strongest appetite stimulating effects, which is why we tend to stay predominantly with Mirtazapine as our sort of preferred appetite administration. However, some cats may be receiving gabapentin both for its anti-anxiety effects or pain relief effects. So sometimes it can have an additional benefit of being an appetite stimulant. There's also another medication called periactin, which can also help to stimulate appetite. However, it also can contribute to sedation effects, and it tends to be less predictable in its effect for appetite stimulation. So the main drug that we really focus on is So the main drug that we focus on is really mirtazapine, either as a capsule or in the transdermal form. Now remember, it's really important, if your cat isn't eating, to seek veterinary attention. For any further information, please don't hesitate to visit our website. We also have lots of information there on how to help tempt feed your cat and other ways that you can look at getting more nutrition into your patient, such as the use of feeding tubes.